There's a lot of misnomers around what AI, artificial intelligence, actually is. In the healthcare world, we see a lot of examples of it when we're looking at algorithms to create diagnostics, looking at reading and interpreting PACS images, for example, making decisions around retinal scans or mammographs. And really, that's really clever, and there's lots of organisations to do that, but that's not something that we're involved with. We think right now the biggest benefit in using automation and intelligence tools is actually in the process of healthcare. It's how do we make the process of getting people through the healthcare system. We are about the process of delivering a more efficient healthcare system, and we're about freeing up humans and freeing up clinical staff and business support staff as well, for that matter, so that they've got more time to do what they do best, which is make human decisions and interface in a way that actually affects and helps people. But what we're trying to do is to say we are in the business of making a hospital more efficient. We're not necessarily in the business of creating IT for the sake of it.
Because of the nature of what they're trying to do, they don't take breaks, they don't relax, they don't deviate from the process. That once they're built and configured, they are locked to a process that's been agreed and is fully auditable and traceable. So if you had a worker that worked flat out 24 hours a day, didn't take breaks, didn't make mistakes, and therefore remove rework and waste from your processes, you're going to realise quite a significant saving in capacity, as well as the possible throughput of what you'll be able to achieve. That's what robotics is able to deliver. So building trust is an interesting one with any kind of technology project, and RPA is one of those that sits within those as well. That's because not only the user adoption, but how you get it. But one of the best parts is the speed at which you can actually deploy it. So where these are templated or where we've already got parts of these built for other services or trusts, those are reusable components that we can use to speed up the deployment of proof of concepts or help you to get to value quicker. What we want to be able to do is share those tools to make sure that everyone can get access to it, to then see how we can democratize that route into RPA and then realize more value for everyone. So the fear of robotics in particular is that they don't understand how they can control it, or they think it's going to go rogue or ruin their data or do something that it's not told to do. The fact is it's a tool and it's a piece of software that does exactly what you tell it to do. If I tell it to go and move things from column A to column B all day, that's what it will do. It won't deviate. It won't make up a new way of doing it. We're not allowing it to make leaps in cognition. That's where the human's important to actually add value and create judgment calls. The robot's job is to replicate what it's been told over and over again.
In any hospital or any NHS environment, the key thing is keeping the staff on board. So this is a change control project, a change management project in the same way as any other implementation of a system is. So it's important that you bring staff with you. It's important that you communicate well. It's incredibly important that you show them the benefit of it. So the worst thing you can do is do it to them. So we work very closely to making sure that we do it together. And we're not here so you have to come to us every time you need to make a change. We're here to teach your staff to look after themselves. And very much so, it is an intuitive technology. It's very easy to use. It's very easy to adapt. And when you see some of the examples that we've saved in terms of people's time, we can typically give 20% of your time back. And what do you want to do with 20% of your time? You will do more efficient things more efficiently, or potentially you'll see more patients, or potentially you'll get through the ever-increasing workload because we're all driving to do more with less inside the health sector. Those are the sorts of things that we can really make a difference with.
So one of the key considerations is more around making sure that they have a strategy for where they want to get to. The worst, and this is true of private sector, public sector, and everybody in between, of when they start out an RPA journey, you can be very siloed. I have a problem that I want to solve, and I'm going to deploy robots to go and do what it is. The thing that I don't like, or the thing that's causing me the most pain. Actually, it's about the entire enterprise and understanding where it can go and how they can leverage it, so that you're not moving pain out of your department and passing it into another, albeit better, faster and quicker, but you're creating a bottleneck within the system. We can help to understand what that entire estate looks like, where the priority lies, and make sure that what you're doing is going to complement each other across the entire strategic roadmap, and make sure that you actually realise that value in a cohesive way that gives you what you expected rather than it just being a service going, that's mine, I'm going to do it and I will run it. It becomes then a tool bag approach to everyone getting what they want in the long run. So the easiest place to start when you're trying to identify the key areas is to look at our process chart that breaks down exactly where this can be used, both front, middle and back office. If you want to start clinical, then you can absolutely start with appointments, referrals, reminders, making sure that people are getting checks when they need to do and that you're managing your do not show rate. If you want to start back office, that can be interacting with your HR, IT, finance systems. All of those paths have been trodden by other people at this point. So it's making sure that we find the one that's right for you and then making sure that that again fits into that strategic roadmap of where you want to go so that you're not impacting potential benefits of other projects that you've got live or other things that you've got currently downstream, and that your implementation of robotics and AI will complement your overall delivery.